My name is Rick Nicolay. I'm a board-certified orthopedic surgeon with subspecialization in shoulder replacements. So if you are considering a shoulder replacement, it's important to understand what the postoperative rehabilitation looks like. In general, for the first week to 2 weeks, there is discomfort after surgery. We help patients manage this with pain medication, icing, and strict protocols to help reduce the pain level. And after 2 weeks, the pain starts to subside. But for the first 6 weeks, we do have restrictions, so most patients are in a sling during that time. After that time passes, we get patients out of the sling and we work with early physical therapy for range of motion, strength, and conditioning. And the goal is by 3 months, you feel quite happy that you did the procedure and you feel better than you were before. But of course, that's not yet the full recovery. After 3 months, slowly as each month goes by, there's progressions with strength, endurance, range of motion, and most patients reach a full recovery between 6 months and 1 year.